Hello, I am Professor Damien Griffin. I'm a specialist hip preservation surgeon and I work in Warwick in the UK. I do a good deal of hip arthroscopy and I train lots of residents and fellows in doing hip arthroscopy. Now this is a tricky skill. It requires the surgeon to be able to triangulate much more deeply than is usually the case in arthroscopic surgery, to use an arthroscope which will have different angles, most often a 70-degree scope, and to use instruments in a small space with a curved surface on the inside of the hip. And we have to do all of that without damaging the delicate articular cartilage of the hip joint. So in order to train a surgeon to be able to do this safely and effectively, so that they can become confident in doing it well, we need to put them through a structured training program. And over the years I've found that the best way to do this is to go through 3 steps. Begin with simulation, then train with cadavers, and finally supervised surgery on our patients. Now the simulation area is very exciting. That's where we have an opportunity to very substantially increase the skill of surgeons before they get to cadavers and especially before they get to our patients. We used to do this with plastic models and I still do sometimes. So a plastic model can be a great way of learning those triangulation skills. But it's not very flexible. I can't set different scenarios for the trainee very easily. And after surgery, often we've got to change parts of the plastic model. So that takes a bit of time and there's some cost. The advent of virtual reality simulators has been fantastic. It's been an absolute game changer in training our residents and our fellows. I love to have a virtual reality trainer available in the department near the operating theatre so that they can use it anytime they like. And use it repeatedly so that they start to get those skills really embedded. They can learn all of those skills. I can set different and challenging environments for them, and I can even set up the simulator so it demonstrates the sort of pathology we're expecting to see in the very next patient. So these virtual reality trainers, I think they're going to become the sort of thing that we use right across surgery. Hip arthroscopy might just be one of the very best applications for it. It's been a complete change in the way that we do training, and I commend it to you.